Drugs used in the treatment or in the management of hypertension can be classified into 10 different categories. Diuretics, AC inhibitors, angiotensin receptor blockers, ARBs, direct renin blockers, calcium channel blockers, alpha blockers, beta blockers, both alpha and beta blockers, centrally acting drugs, and vasodilators. Let us see the example of individual category of drugs. Number 1, diuretics. Diuretics can be further classified as thiazide diuretics, loop diuretics, and potassium sparing diuretics. Examples for thiazide diuretics include hydrochlorothiazide, chlorthalidone, indapamide, and metolazone. Examples for high ceiling diuretics. Why it is called high ceiling diuretics? Because when dose increases, the action also increases. Examples include furosemide, bumetanide, torsemide, and ethacrynic acid. The third category of diuretics is potassium sparing diuretics. Example, amiloride, spironolactone, and triamtrin. So, depending on the patient conditions, the diuretics are given for hypertension. Diuretics are said to be the first line of agent, especially thiazide diuretics are said to be the first line of treatment for a newly identified hypertensive patient. The next category of drug are AC inhibitors, angiotensin converting enzyme inhibitors. For example, captopril, enalapril, lisinopril, imidopril, perindopril, ramipril, fosinopril, benzapril, and trendolopril. So these are the drugs which can go and block the angiotensin converting enzyme so that the angiotensin formation is reduced. We know that angiotensin is the one which causes vasoconstriction and increases the BP. So this vasoconstriction is blocked by using these angiotensin converting enzyme inhibitors. The next category of drug are the one which are angiotensin receptor blockers. They go and block the angiotensin receptors directly. For example, losartan, telmisartan, candicertan, valsartan, olmesartan, eprosartan, etc. There is another category of drug which directly goes and blocks the renin secretion. Example, aliskiren. The next category of drug is calcium channel blocker. The calcium channel blockers, example, verapamil, diltiazem, nifedipine, felodipine, amlodipine, nitrandipine, lazidipine, isradipine, nicardipine, etc. So most of these drugs, they go and block the L-type calcium channel. Beta adrenergic blockers, generally called as beta blockers, for example, propranolol, metoprolol, atenolol, acebutolol, bisoprolol, nadolol, pindolol, timolol, etc. So these beta blockers, some of them are selective, some of them are non-selective. For example, propranolol is a non-selective beta blocker. It acts on both beta 1 and beta 2 receptors. So depending on the patient condition, suppose the patient is having asthma problems, non-selective beta blockers. In general, beta blockers are avoided, but if it need to be given, only selective beta blockers should be given, like atenolol or metoprolol. Next category is alpha adrenergic blockers. Example, prazosin, terazosin, doxazosin, phentolamine, phenoxybenzene, etc. Both alpha and beta adrenergic blockers are also sometimes used, like carvedilol and levetolol. There are few centrally acting alpha agonists, alpha-methyl dopa, which is again a drug of choice for the pregnancy-induced hypertension, that is called as gestational hypertension, clonidine, guanabens, and guanafacin. The last category of drug are vasodilators, like hydralazine, minoxidil, and diazoxide. These three are arteriolar vasodilators, whereas sodium nitroprusside is both arteriolar and venular vasodilators.